Hello, everyone. My name is Johnathon Goree. I am a physician and an anesthesiologist. I work at the University of Arkansas for Medical Sciences, where I am an associate professor in the Department of Anesthesiology. I'm also the director of the Chronic Pain Division. I am the chair of the Opioid Stewardship Committee, and I consider myself a quality of life physician, and that's something that I hope to discuss today. So I became really passionate about treating chronic pain due to a couple of experiences that I had personally. Uh, the main one was that when I was in medical school, I had a surgery and I had a wisdom tooth that was removed, and it had to be surgically removed because of the way that it was growing in. And I went under anesthesia and I went to sleep for the surgery, and the tooth was removed. And then when I woke up in the recovery room, I had really severe pain. And the nurses saw that I was having pain and they came over and they gave me some fentanyl. And some of you may have heard of fentanyl. It is a medication that's often been abused out in the street currently. It's a big part of the opioid epidemic. But we use it commonly in the operating room to treat chronic pain or to treat acute pain or pain after surgery. Unfortunately, the nurse accidentally gave me a little bit too much, and I actually stopped breathing. And in order to save my life, the team gave me a medicine called Narcan or naloxone, which is the reversal agent for pain medication. And what that medication, naloxone or Narcan, does is it binds to all of the pain medication, even the natural pain medication that's in your body, and takes it away, so that someone who is so comfortable that they can't breathe will instantly experience full pain so that it will prompt them to wake up and start breathing. So after that happened, I, for the first time in my life, experienced 10 out of 10 mind numbing, all consuming chronic pain. And that really led me into my career because I then realized that there are patients who we see on a day to day basis who experience that same mind numbing, all consuming 10 out of 10 chronic pain, really honestly for their entire life and for their entire experience. The other piece kind of led me to two of my other passions that have branched off of pain, and one's very pertinent to this conversation. One is that a lot of the folks who I've seen who've experienced that pain or who have not had access to high quality pain care look like me. And unfortunately, there is an implicit bias, a racial component to how we offer pain treatment. And so that is one of my passions. The other is that we do not always maximize one, our body's ability to heal from an insult, but also kind of the natural, the the remedies for chronic pain that we have around us that may not be medical, that may not be surgical, that may not involve an injection or a procedure. And that's really what I wanted to talk about today is really how that has transformed my quest to treat chronic pain honestly into a quest to improve quality of life. And so, kind of taking that a step forward, whenever I see a patient, and the majority of my clinical practice is patients who medicine does not have an answer for their ailment. So, we have a number of people, whether that be cancer, whether that be after a surgery, whether that be after an injury, who They go to their doctor and their doctor says, I can't fix your problem. And oftentimes, those people are lost, they're confused, they don't have guidance, they don't have an answer. And those are the patients that normally end up seeing me. And my job is to figure out how I can best improve their quality of life. When you think about quality of life, it doesn't just include pain or the absence of pain. I really think of quality of life as really five things. I think comfort, the lack of pain is definitely one of those five. But if I'd like for everyone who's listening to really think about the things that can happen in your day that really make your life hard or that can really decrease your quality of life or your enjoyment of life. The second is sleep. If we don't get good sleep, if we don't get good rest, I'm sure that all of us have had a moment where something has woken us up in the middle of the night and it's been really challenging to make it through our day. We're tired, we don't feel good. But even more importantly, as we look at things over time, sleep is when our body heals. Sleep is restorative. And so, in order to heal from disease, and that's any disease, we need to make sure that our body is getting the proper rest and restoration. The third is mood. And I'm sure that all of us have woken up on the wrong side of the bed and really understood how that's affected our day. Unfortunately, there are some patients who have depression, who have chronically down mood or chronically up mood, which can be termed as bipolar disease. And so, um, whenever we have instability or changes to our mood, that can definitely affect our day-to-day quality of life. The fourth is motion. Um, we as humans are made to move. We're made to be active. And I've often found that people who are more active often are more happy, it releases endorphins and improves their quality of life. They're often healthier, they have less health complaints. And again, movement is lubrication for the joints. And so patients who have arthritis often do better the more that they move. And the last one is nutrition. Um, it's really challenging for our bodies to heal. It's really challenging for us to push through our day and be our best selves if we aren't giving ourselves the proper fuel. And so, looking at these five things, I think that medicine has really done a good job focusing on pain. And some can argue that we've maybe done too good a job focusing on pain. And that's what brought about the opioid epidemic, is the push to make sure that none of our patients have any pain. And we have done better with mood. I would say that access to high quality psychologic and psychiatric care is lacking. But when we look at sleep, motion, and definitely nutrition, we as a medical community have not really focused on those three factors in not only determining quality of life, but also to promote overall wellness, which to me, wellness is a state of high quality of life. So let's take a look specifically at nutrition. For one, nutrition is not well taught in most medical school environments. And that's something that my institution is currently working to change, adding in a culinary medicine component to medical education. But it's also not necessarily incentivized by our medical reimbursement system. Uh, physicians or even other health professionals really aren't reimbursed for nutrition counseling. So we have something that we all can agree is important when it comes to determining someone's quality of life and someone's health outcomes. But it's not something that we truly focus on as a health community. The second piece is that we all know that healing takes proper nutrition. When we look at chronic pain, we know that a lot of chronic pain is actually stimulated because of lack of proper healing from an insult or injury. For example, if someone was to break a bone and they didn't heal that bone in exactly the correct manner, then it's very possible, or I would say probable, that they are going to develop chronic pain in that area due to lack of complete healing. Whenever patients have a surgery, I think that we as a medical community need to really think about how we can ensure that those patients have the proper diet and proper nutrition prior to those insults so that their body can better heal, so that their body can better fight infection, and so that they can have a better quality of life. I've really instituted this into our pain treatment, really because I think that poor nutrition and chronic pain often go hand in hand. Many patients who have chronic pain are obese because they are not, and we also, when we think of malnutrition, we often think of the pictures that we've seen on television of people in third world countries who look emaciated. But there are a lot of Americans who actually are obese, who have high BMIs, who actually are not getting really good quality nutrition. And so that's something that we've included into our pain evaluations. We talk to patients about what they eat, how often they eat, where do they get their groceries, um, and where do they get advice on what is proper. And when you talk to patients about this, many of them go back to food pyramids that they learned when they were in school. And I think most of us know that a lot of that information has been tainted by a number of factors. It's been tainted by money, it's been tainted by different incentives, and may not be in the best interest of people. The other thing I wanted to talk specifically about is inflammation. And um, a lot of chronic pain related states really do center around inflammation. And a lot of the things that are in the standard American diet, um, and this has been shown in a lot of work, especially a lot of the work by Tickle and Campbell, looking at dairy, uh, some arguing even looking at animal protein in and of itself. But I would say definitely looking at dairy and gluten are two really pro-inflammatory foods. Many types of alcohol are very pro-inflammatory. And so when you have a disease state, and looking specifically at what I do, chronic pain, but I would say many disease states have an inflammatory component. When we look at um, asthma, for example, and a number of other diseases, Tickle and Campbell would also say cancer. We should consider that what we're putting into our body should also be medicine. And so, what I would say as a few takeaways is as we think about food, as we think about nutrition, and as we think about medicine, there are a lot of gaps that I think that we can all, and that includes those in the medical community and those not in the medical community, can advocate for. I would say first, I think the best place to start advocacy is to advocate for yourself. And so, as you are diagnosed with different disease states, be it obesity, hypertension, hyperlipidemia, or high cholesterol, high blood pressure, diabetes, etc., I think it's okay to ask your physician whether you can have a conversation about your diet and how that may be affecting your disease state. And I think it's okay to push your physician to discuss alternatives to traditional medical care. And I really think that alternative or complementary medical care and traditional Western medical care don't have to be in opposition. And we're often taught that they need to be. I think there is a happy marriage between the two. I don't believe that diet can cure everything, but I also don't believe that medicine can cure everything. And I think it's figuring out how to best utilize our knowledge of the two to fight for the best outcomes for our patients. I would say second, the second place is then advocacy needs to happen on a regional and national level. We have to make sure that these kind of conversations are pushed and incentivized in our healthcare. The other is access. And I think we would be amiss to not discuss the issues with access. Um, Food deserts and access to high quality fresh food is challenging in a lot of communities. I live in Little Rock, Arkansas, and there are a number of food deserts in Arkansas. And you may be asking what a food desert is, but that is an area where people don't have access to high quality fresh food. And when you look at those communities are often communities of color. And the access to food in those communities is normally a combination of fast food, quick food, based on food that you can buy at convenience stores, etc., and cost-friendly alternatives to grocery stores, like like a Fred's or a Dollar General or a Dollar Tree, etc. If this is where you do your grocery shopping, it's very hard to eat a high quality, healthy, high fuel, high nutritious diet. And so we have to do the work and push our businesses, our communities, our city and local governments, and our national governments to make access to not only education, and I think a lot of people push on the education piece, but I think lastly, on the access piece, because access to care is equally as preventative as lack of knowledge about care. Um, I wanted to conclude really with my own personal family story. And so um, I have, over time, as I've learned more and more about quality of life and health and diet, I've changed my own diet. And I think that if we're going to push for these things, we have to first look internally. And as a physician, I have to make sure that I am able to discuss my own story with my patients so they can understand that a Black man who grew up in the South, who grew up on catfish, cornbread, and fried chicken, can alter his diet to eat more whole foods and to eat a more plant-based centered diet, which I think is one of the ways to ensure, and I think I really do harp on whole foods, eating real food, things that aren't packaged, things that aren't pre-prepared, as a better alternative to prepackaged food. With that, I thank you for your attention. I discuss a lot of these things through different medium. One that, if you have more interest or you'd like to reach out to me and discuss some of the things that I've talked about or some of the other things that I've mentioned about chronic pain, then feel free to follow me at Drj Goree on Twitter, where I often continue this discussion. With that, I thank you for your attention.